The project aims to evaluate the performance of a transformer-based model that is able to handle longer sequences of text. What is hospital readmission? A patient is considered a readmission if, after taking care and then discharged from a clinical institution, within a time frame he is readmitted again, and this phenomenon tends to increase healthcare costs, can lead to bad clinical outcomes for the patient, and can be considered indicative of problems with the quality of care of a certain institution. What are clinical notes? Clinical notes are sequences of text, and this is unstructured information about patients. They can sometimes have exclusive information that cannot be found on structured data such as lab results. And clinical notes have been used on NLP for text summarization, information extraction, predicting chronic diseases, hospital readmission, mortality, and length of stay. First, the baseline models used in this project. The first one is the deep averaging network, that is a model that is similar to the bag of words, where the bag of words features are replaced by word embeddings. Then a mean of all the word embeddings is calculated, and the resulting vector can be fed to one or more nonlinear layers before a final softmax layer if doing classification. The second baseline model used is an RNN, that is a neural network that's designed to handle sequential data such as text, where the output of a neuron is fed back as input to the following neuron. This architecture has issues with vanishing or exploding gradients, and to deal with this problem, a kind of gated cell has been introduced, the LSTM. There has been experiments with explicit memory and attention mechanism. This model processes data one step at a time and tend to be slow because of that. One model that is able to overcome the exploding gradient problems is a transformer. Transformer is an architecture with no recurrence and consists of an encoder and decoder with an attention mechanism. They are able to capture dependencies in longer sequences. They are more efficient and can be parallelizable. These models can also be trained on a large corpus of text and then fine-tuned for your task specific. But they have a hard limitation of the number of tokens that they can process at a time, which is 512. This brings us to the Longformer, which introduces an alternative to the full attention mechanism of the standard transformer, and this consists of a windowed self-attention where not all tokens attend to every other token, and also a task-specific full attention. This model can handle up to 16,000 tokens. For the dataset, we used the Mimic3 database, which is a freely available medical database of the identified patient records. It consists of structured and unstructured information such as clinical notes. For evaluating the performance, we used the area under the precision recall curve, which is a metric that presents the trade-off between the precision and recall across different decision thresholds. In our current results, the transformer-based model BERT has the best performance. It is slightly better than the LSTM and significantly better than the deep averaging network. The Longformer is still a work in progress.